Alright, I'm going to do an O2 scenario. So the first thing I'm going to do is check the patient's chart. And so I checked the patient's chart and I noticed that they just got out of operation and they had a nasal surgery done. And so I'm going to go in and check on the patient. So I knocked on the door, introduced myself, and I noticed right away that they are not on the appropriate device that I think would be best for them, especially after they just got done with nasal surgery. They had been placed on a simple mask, so after I wash my hands and everything, I'm going to change the device to a face tint since they had a nasal surgery, and then I'm going to apply humidity device to kind of keep it cool and keep it humidified so that way it helps from any nosebleeds from the nasal surgery. So the first thing I'm going to do is I have a face tint here. I'm going to get this one off of the patient. I'm going to remove this patient here. And with the face tint, you'll have corrugated tubing with the face tint. So I have my corrugated tubing connected to here and to the humidity device and the O2 device. So here I would place this at the bottom because that's where the chin would go. So I place it down here, make sure it's kind of spread out so that way it's not harming the patient there. I place that around, and this way it helps. It still gives them the oxygen that they need, but then it's not going to touch the nose and it's not going to make them feel claustrophobic, especially that's where they had the surgery. So after I change a device, I always need to double check and check the patient's vital signs and listen to their lungs, make sure they sound okay. And especially after operation, always check to make sure the lungs don't get any atelectasis, anything like that. So when I'm done, I wash my hands. I'd always come back and check on them. And I'm going to chart on the patient's chart and talk with the doctor to let them know that I changed them to a face tint. That way it helps them, especially after them having nasal surgery.